The SuPREME CD trial. Top-down strategy. Welcome to the Everything Surgery podcast, where we delve into the pivotal studies shaping the future of medical practice. Today, we are exploring the SuPREME Crohn's disease trial, a landmark clinical investigation in the management of Crohn's disease. Let us begin with the trial's core objective. The SuPREME Crohn's disease trial set out to determine whether early intervention using a top-down strategy, commencing treatment with a biologic drug in combination with an immunosuppressant, provides superior outcomes compared to the conventional step-up approach. In the step-up strategy, patients first receive steroids, and only escalate to immunosuppressants and biologics if symptoms persist or recur. This study focused on individuals with newly diagnosed, moderate to severe Crohn's disease who had not previously received biologic or immunosuppressant therapy. The trial employed a randomized, open-label, multi-center design and was conducted across Belgium, the Netherlands, and the United Kingdom. In total, 128 patients participated, each with active Crohn's disease diagnosed within the previous 4 years. These participants were divided into two groups. The first group, representing the top-down strategy, immediately began a regimen of infliximab, an anti-tumor necrosis factor biologic, combined with azathioprine, an immunosuppressant. The second group started with corticosteroids, such as prednisolone, and escalated to azathioprine and infliximab only if symptoms were not controlled or recurred. Now, let us turn to the principal findings. The top-down strategy demonstrated clear advantages in both achieving and maintaining remission without the need for steroids or surgery. At 6 months and 1 year, a significantly higher proportion of patients in the top-down group achieved steroid-free clinical remission compared to those in the step-up group. Furthermore, remission was reached more rapidly in the top-down group. Over a 2-year follow-up period, none of the patients in the top-down group required major abdominal surgery, whereas approximately 5 to 10% of those in the step-up group did. Another noteworthy outcome was that a greater proportion of patients in the top-down group achieved endoscopic healing of the intestinal mucosa, which is a critical goal associated with improved long-term prognosis. In terms of safety, the top-down approach maintained a manageable risk profile. Although there were more infections reported among patients receiving early biologic and immunosuppressant therapy, there was no significant increase in serious adverse events. The significance of the SuPREME Crohn's disease trial cannot be overstated. It brought about a paradigm shift in the treatment of Crohn's disease by challenging the long-standing step-up approach. The evidence demonstrated that early, aggressive intervention with biologic therapy in suitable patients leads to better clinical and endoscopic outcomes. This study also reinforced the treat-to-target philosophy, encouraging clinicians to aim for mucosal healing rather than focusing solely on symptom control, an approach that can fundamentally alter the disease trajectory. The findings have influenced major international treatment guidelines, such as those from the European Crohn's and Colitis Organization, which now advocate for early anti-tumor necrosis factor therapy, especially in patients presenting with poor prognostic factors such as young age, extensive disease, perianal involvement, or an immediate need for steroids at diagnosis. There are, however, important caveats to consider. The trial was open-label, which may introduce bias, and it was relatively small in scale. It investigated only one biologic agent, infliximab, though the principle has since been applied to other drug classes including vedolizumab and ustekinumab. The top-down strategy is not appropriate for every patient and is generally reserved for those with moderate to severe disease and poor prognostic indicators, given considerations of cost, practicality, and potential risks. In conclusion, the SuPREME Crohn's disease trial stands as a milestone in proving that early intervention with a combination of biologic and immunosuppressant therapy is more effective than the conventional step-up approach in achieving steroid-free remission and mucosal healing for patients newly diagnosed with moderate to severe Crohn's disease. This research has helped to establish the modern paradigm of early, targeted intervention, fundamentally altering the long-term management of this challenging condition. Thank you for joining us on the Everything Surgery podcast. If you found this discussion insightful, please like, share, and subscribe for more in-depth explorations of the studies that are changing the landscape of medicine.